INSACOG, which is a consortium of genome sequencing, has released a bulletin just 24 hours back where they have in fact stated that as far as JN.1 is concerned, the sub-variant of Omicron is concerned, from November till January 28th, we have seen about 2,083 cases of JN.1 and its sublineage. Now, when we talk about these 2,000 cases, out of which around 800 cases are specifically of JN.1, which is the subvariant of Omicron, and the rest of the cases, around 900 of them, are in fact of the sublineage of JN.1. So, we have seen the kind of measures that has been put in place by the central government. They have asked all the states to keep a close vigil. A guideline has also been sent to them, if you remember, around the festival time, around Diwali, Christmas, when the cases were in fact rising. Now, if you have seen in the first week of January, the caseload in India was over 3,000, but right now in last 24 hours only 112 cases of COVID has been reported, and the active caseload is in fact as less than 1,400 cases. So, giving this number that we are seeing, the health ministry has in fact been saying that there is no need to worry at the moment. The COVID-19 cases, which were in fact increasing in the last week of December and January, first week of January, has now in fact dipped to in fact a very substantial level. Apart from that, they have also in fact asked all the states to ensure that even when there are patients who are coming in with severe acute respiratory illness or influenza-like illness, they should give their sample for COVID testing, and if they are positive, then that should be in fact sent for genome sequencing, because genome sequencing is the only way to find out which variant is in fact doing the rounds in the country. So right now it is JN.1 that is doing the round, but even then the health ministry has been saying that clearly the data that has been collected so far in India has shown that these cases have not led to hospitalization. People who were infected with JN.1 were in fact recovering from their home, from their respective places itself. So nothing to worry at the moment, but at the same time we need to stay vigilant, because remember, the WHO has in fact said that these mutations, these variants will keep coming. There will in fact be new variants that will happen, and this could lead to new infections as well, new symptoms as well. So this is going to be a round the year thing when it comes to COVID-19, but at the same time the WHO has in fact said that there's nothing to panic, and we have to in fact be vigilant. We have to ensure that we maintain distance from infected people, we maintain the hygiene that is in fact been said in the guideline by the WHO.